Morning everyone. I just want to take a minute to run through the most common questions we get asked in the clinic kind of relating to weight loss medication. So first thing we get asked, what will I feel when I start weight loss injections, and what are the kind of the things that I'll notice? So first thing you'll feel is your appetite suppressed. So what that means, if you have a plate of food or a plate of dinner, you'll find that you can no longer eat the full plate. So the portion that you had before, prior to starting the weight loss medications, that you could eat, you now won't be able to eat, and so it reduces portion size going forward. The next thing you'll feel is, because it keeps food in your stomach for longer, when you do eat something, you'll just feel fuller for longer, and so you'll feel that you don't feel like snacking between meals, or you're not as hungry between meals. And the final thing you'll feel is it cuts cravings for things like chocolate, crisps, cakes, biscuits, sweets, things like that. So you'll tend to stop eating them. Next thing we get asked a lot, how long till we start feeling the effects? So usually, most people say they feel it within kind of a couple of hours, 12 hours, can be up to 72 hours. So that's quite common if you don't feel it before that. Next thing, Aidan, how long should I use it for? And this is quite hard because everyone's different. It depends on your goals. So it's best to set a goal at the start. Some people's goal might be they want to lose a certain amount of weight, or they want to feel a certain way, or they want to be a certain size. And then just kind of reassess your goal every month as you kind of progress. My thing is, just don't put pressure on yourself. Just take it a month at a time. After each month, reassess, we'll have a chat, we'll have a catch up, and just see if you're at the point you want to stop, or if it's something you want to continue on. Next time we get asked a lot, can I drink alcohol when I'm using Manjaro or other weight loss medications? And yes, listen, we're realistic, we're normal people. We want people to have a lifestyle that can be sustainable and that they can enjoy. So in moderation, alcohol is absolutely fine. It's not something that we would say, you can't have at all, you have to be completely abstinent. So it's just about being sensible. So if you are going to have a drink alcohol, just be sensible, don't overdo it, and just make sure that when you are having a drink and the next day, you increase your fluid intake. And that leads on to probably the next most common question: how much water or fluid should I actually take? And for me, it's a minimum of 2 litres a day. 2 to 3 is even better. And the reason we say this is, when you don't drink enough and you become dehydrated, you get much more chance of things like sore head, dry mouth, constipation, feeling sick. So by actually drinking plenty of fluids and consistently, not just a big drink in the morning and a big drink in the evening, like an actual getting up in the morning, filling up a 2 litre bottle, sipping it throughout the day, and that will really help you to get the most from the medications, reduce side effects, and allow your body to kind of lose some weight, because you have to be hydrated to do that. Now, it doesn't have to be just water. It can be water, diluting juice, tea, coffee, flavoured water, sparkling water, whatever it is you like. And you can have fizzy juice, but what we try and recommend is, if you're going to fizzy juice, that's fine, but try and have water-based fluid as well, because that will benefit you even further. And that was just probably 5 of the most common questions that we get in the weight clinic. And thanks very much. Bye for now.